ए ज्योति Yes.
Coming together is a beginning. Speaking together is progress. And working together is success. Very good afternoon, everyone. I, Dr. Divya, and Dr. Sejal, welcome to our respected Dr. Abhay Datarkar sir, Dean GDCH Nagpur, Dr. Manjusha Bharat Pandey ma'am, Vice Dean Academics, Dr. Mangesh Patnaik sir, Vice Dean Administrative, today's chief guest, Dr. Ram Reddy Eltivar sir, guest of honor, Dr. Abhay Kolte sir, today's subject expert, Dr. Rajeshri Kolte ma'am, and Dr. Sai Deshpande ma'am, all the head of department, staff, and my fellow colleagues. It gives me an immense pleasure to welcome you all for the installation ceremony of the first Link Next activity of the year 2024. As we all know, the activity for postgraduate students was started in Government Dental College and Hospital Nagpur way back in 2003 under the guidance of Dr. Hazare sir in presence of Dr. Lele sir. As it is rightly said that a great leader knows the way, goes way, and shows the way. Likewise, the continuous efforts of the pioneer mentors of Government Dental College and Hospital Nagpur, Dr. Ganveer ma'am, Dr. Vasundhara Ward ma'am, and Dr. Sujitra Gosavi ma'am led to the upgradation of the PG Club to Link activity in 2005. Dr. Yeltivar sir was the very first PG Club in charge and is also present today as chief guest. We are very fortunate to have you, sir. Upgradation of links to Link Next multidisciplinary approach to oral care activity was done with the aim to provide a platform for healthy interaction of knowledge among the postgraduate students. The traditional way to commence any event is by lighting the lamp. So I request all the dignitaries to please come forward to light the lamp.
ये पंखे बंद करो फोटोज गए हाँ जी बंद ठीक हो सर ये वो भी फोटो नहीं 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 वहीं से नहीं अच्छा अच्छा हाँ
मैडम
Yes. Yeah. Yeah.
Now we request all the dignitaries to kindly be seated on the dais. I request Dean sir to kindly felicitate Dr. Yeltiva sir. I request Khadnaik sir to felicitate Abhay Kote sir. I would also like to request Dr. Vaibhav Karamore sir to felicitate our respected Dean sir. I request Vaibhav Karamore sir to felicitate our Dean sir. Vice Dean sir, Varai Pandey ma'am and Padle. I also request Dr. Varai Pandey ma'am to kindly felicitate our subject expert Dr. Rajeshri Kote ma'am. Ma'am has completed her BDS in the year 1995 and MDS in periodontics and implantology in GDCH Nagpur in the year 1998. She has completed a diploma in hospital and healthcare management from YCMOU Nagpur. Ma'am is currently working as a professor, PG guide and PhD guide in the Department of Periodontics and Implantology in BSPM Dental College Nagpur. She is awarded merit by ISP for standing first in the subject of periodontology. Colgate Gold medal for obtaining highest percentage marks in BDS examination. She has also received a patent, a device used to measure an intraoral dimension required for implant placement. Ma'am received 15 copyrights, more than 100 national and international publications. contributed chapters in the textbook of Fundamentals of Periodontology and Oral Implantology, third edition. I call upon Dr. Sulekha Gosavi ma'am to kindly felicitate our subject expert, Dr. Saeed Oshpande ma'am. Ma'am completed her BDS from VSPM Dental College in the year 2002. She completed her MDS in orthodontics from GDC Nagpur in 2006. Currently working as a professor, PG guide, and PhD scholar in the Department of Orthodontics in GDCH Nagpur. She received 25th Henry Thornton SCADA Educational Grant, Fellowship in Pierre Portrait Academy, Fellowship from International Clinical Dental Organization, Emerging Young Talent Award by VSPM, Award for Innovative Practices by VSPM, Best Individual Performance by VSPM, Teacher Scholarship Award by MUHS, awarded as the Best Innovation in Oral Healthcare Innovations, winner of the Best Product Design Award, awarded International Travel Grant by ICMR, award author 56 publication and over 151 citation, authored chapters in 2 books, 4 copyrights and 1 patent. I request Dr. Sulekha Goswami ma'am, link in charge of the year 2022 to 23, to kindly give us a brief of the previous year's links activity.
Thank you, Dr. Divya. Good afternoon, Dean, Vice Deans, all heads of departments, distinguished guests, subject experts, dear colleagues, and postgraduate students. It is with great pleasure I stand before you to present a comprehensive report on PG interdisciplinary activity that has been a hallmark of our institution over the past year. Throughout the year, we have witnessed the transformative power of interdisciplinary collaboration as exemplified in the series of case report presentations conducted under the Link Next multidisciplinary approach to oral care. These activities have showcased how convergence of diverse disciples within the dentistry can lead to enhanced diagnostic precision and the delivery of holistic treatment approach. In series of 6 events conducted alternative month, a total of 12 presentations unfolded. Each presentation has served as beacon of innovation and discovering the imperative of collaborative practice in the modern health settings. Insights from the subject experts have been valuable. Their inputs in treatment approach emphasize the importance of holistic care and interdisciplinary collaboration. Implementing their suggestions have been already shown positive impacts on the patient outcome. Additionally, feedbacks from all the stakeholders on the activities conduct highlighted areas of improvement. We commit to implement the suggestion through the collaborative action involving all stakeholders, uh, action plan involving stakeholders together. We continuously enhancing both over the treatment approach and conduct of our interdisciplinary activities to provide best care possible. We have taken initiative to compile these presentations into a journal publication that is linked next, a journal of postgraduate club. In closing, I would like to extend my heartfelt gratitude to Dean Dr. Abhay Datarkar sir for graciously providing us with the opportunity to conduct the next postgraduate activity. His unwavering support and guidance have been instrumental in success of this endeavor, and we are truly grateful for his leadership. At last, I would like to thank all head of the departments, my fellow colleague staffs, and my co-editors, Dr. Pooja and Urvi, for their untireless help. As we transition to new phase, I'm confident that the Link Next postgraduate activity will contribute to the flourishing under the steward of our new committee members, Dr. Vaibhav Harimore, Dr. Divya, and Dr. Sejal. I once again thank you everyone for their contribution to the success of Link Next.
We appreciate your efforts, ma'am. I request Dean Sir to felicitate Dr. Sulekha Gosavi, ma'am, as a token of appreciation for her hard work throughout. We would also like to felicitate Dr. Urvi, ma'am, and Dr. Pooja, ma'am. I request Dr. Manjusha Varadpande, ma'am, to felicitate Dr. Urvi, ma'am, and Dr. Pooja, ma'am, for their efforts. I now request Sulekha ma'am to hand over the charge to Dr. Vaibhav Karimori sir as the link in charge for the year 2024. And Dr. Urvi ma'am and Dr. Pooja ma'am to hand over the charge as link editors. I request Dr. Vaibhav Karimori sir for welcome speech.
Very good afternoon. Dignitaries on the dais, my teacher, my mentor, आपल्या सगळ्यांचे सर, डॉक्टर राम रेड्डी के येल्टीवार सर, today's chief guest. Dr. Abhay Kolte sir, Dean, Ranjit Deshmukh Dental College and Research Center, Hingna, Nagpur. Our beloved Dean, Dr. Abhay Datarkar sir. Both the vice deans, Dr. Mangesh Pandai sir and Dr. Manjusha Varadpande ma'am. And just now she has happened as a ex link in charge, Dr. Sulekha Gosavi ma'am, MOCs, all the HODs present in the auditorium, all the staff members and all the future officer in charges of link activity, क्योंकि ये लोग भी कभी कभी यहाँ थे जैसे कि आप है all my fellow PG students I will say. Good afternoon all. One fine morning, sir called me. Sulekha ma'am was sitting in his chamber, and he said, "तुला आता बसणार link in charge बनायचं." I was quite shocked. That was quite a sweet shock for me. Before I go into the nostalgic moments, he only started. Who was your officer in charge? Well, sir, was my sir, Dr. Yeltiva sir, at that time. And I know that you were president at that time. This PG Link or PG Next activity was popularly known as PG Club in those days when we were doing our post graduation in this prestigious institution. PG Club, we were having PG Club in charge, Dr. Yeltivar sir, president, secretary, and the editor. This was a team at that time. Okay, so I was the president at that time of PG Club. So sir said this is a generation transfer. That was a moment when your sir was PG in that PG club in charge. Now you are going to become a PG club, that is PG Link next in charge. So it was really, that's why I said that was very sweet nostalgic shock for me, and I readily accepted sir's whatever he want to bestow this responsibility to me, and today we are just observing this day. Thank you very much, sir. Dean sir. Now when it has given to this task is given to Vaibhav Kare More and कुछ तो तड़का नहीं लगे तो ऐसा हो नहीं सकता because you know थोड़ा सा कुछ होता है with all the support of my fellow friends विवेक है सत्यम है दर्शन है इवन महेश है वैभव है थोड़ा सा हम बैठे and we had some कि कुछ तो भी नया कर so let's use the technologies we have. We have our website, we have our YouTube channel. Today this program is going live. You can see, you go to jdcnagpur.edu.in. बिल्कुल आपको डैशबोर्ड पे मिलेगा. Our program is going live today. One surprise quiz will be there. I don't know कितने questions ready हुए हैं. So just आपको busy रखने के लिए there will be a quiz. And I promise you the journal which is going to be published will be in quite different form. They are taking much efforts for that. So this new team of PG Link next will give you a very authentic and very nice journal in the coming years. Now, some changes. What we have done quiz. We are going to introduce from this or maybe from the next PG Link activity. I request you all to give two things wholeheartedly. First is the attendance, and second is the feedback. Because your attendance and your feedback will definitely help us to improve the activity day by day. With this note, I'll like to take. I'll thank you all basically, and I'll end up with my two words. Thank you very much. Welcome all for the PG Link activity 2022.
I now request Dr. Sulekha ma'am, Dr. Urvi ma'am, and Dr. Pooja ma'am to please come forward for the release of the Link Next Journal of the year 2022-23. I now request our Dean, Dr. Abhay Datarkar sir, to kindly address the gathering.
Respected dignitaries on the dais, chief guest for today's installation ceremony of Link Next 23-24, my teacher, my mentor, Dr. L.T. Vasan, the Satkar Murti for today's this particular program, my senior now can call as my friend and colleague, Dr. Abhay Kolte sir, our vice deans, Dr. Mangesh Patnaik sir, Dr. Manjusha madam, the link in charge for 22-23, Dr. Surekha Gosavi, and the link in charge who has just now taken over for 24-25, young dynamic Dr. Vaibhav Karegore. The experts for the today's link, Dr. Rajeshri Kolte madam and Dr. Saeed Deshpande, all the professors, PG teachers, and my dear students. You all are aware about the link activity, which was started in 2004 and today is 2024. So almost 20 years of activity, which is being getting upgraded with leaps and bounds every year. When I took over as a dean of this particular prestigious institution, because I was professor and head of the department here also for the last 5 to 6 years. So I thought we should make it really an interdisciplinary activity, because the pattern which was followed was also very good, but somewhere the interdepartmental activity linkage was comparatively was not much there. And I handed over this particular responsibility to Dr. Gosavi madam. She said, "Sir, मी खरंच करू शकेल का?" म्हटलं मॅडम तुम्ही करा, आम्ही सगळे आहोत तुमच्यासोबत, डोंट वरी अबाउट दॅट. वी आर देअर इज यू शुड नॉट वरी. Madam, I must tell you, because the last activity which happened under your leadership, that is what I was expecting, and that was the real interdisciplinary discussion what I always wanted to be. Okay, and you have really come up to the expectations what we all the faculty wanted to bring this particular link next activity to the next level. So she modified the logo, and the logo was also designed a new logo. So and usually my promise to all the officer in charges, for 2 years you are supposed to work, then we'll change it. Okay. And when she finished up the last activity, it was already 2 years of the work. I thought to whom I should hand over this particular responsibility. So an idea came to my mind, because I was aware that Eltivar sir was the first officer in charge for this particular link activity. And then I thought of like, why should not we pass on this particular legacy to the next generation, like what exactly we want the link next. And then I started inquiring about who was the in charge or the editor for that 2004 and 2005, when Eltivar sir was the officer in charge. And to my surprise, he was none other than his own student, Dr. Vaibhav Karemore. So we were just discussing, and I called Vaibhav and he readily accepted. So the purpose was just to pass on the legacy to the next generation. That is the most important thing. Okay. What was the structure of the activity in 2004? What is today? I told you like it has grown with the leaps and bounds. And I'm sure under the leadership of Dr. Karemore, it will again come up with new ideas, new innovative ideas. Okay. And that is what we are supposed to do or give it back to the institution. Eltivar sir was my teacher during my undergraduate days. And then we used to follow sir. Like I must tell you, sir was and sir is the most popular teacher amongst all his students. Okay. And we must give him a big round of applause. Why he is popular? Well, काय आहे की प्रत्येकाचे काहीतरी कॅरेक्टर राहतात की हे सगळे टीचर्स 19-20चा फरक राहतो शिकवण्यामध्ये, नॉलेजमध्ये. बट एक किंवा दोन लोक पॉप्युलर बनतात आणि बाकीचे पॉप्युलर राहतात पण नॉट. So sir was one of the most popular teacher when we were also the students. Okay. And the reason is only because he was having one-to-one interaction with all the students. Okay. That is the most important thing. And still today also, if you see, every day in the morning, whosoever is having the birthday, the first wish comes from the Honorable Dr. Eltivar sir. And that is the reason, this is how your teacher should be, this is how your mentor should be. Okay. And we are really blessed to have you as our teacher and as my mentor. And we call sir as a Guruji. मराठीमध्ये गुरुजी म्हणजे काय की ज्यांनी खरंच तुम्हाला फक्त शिकवलं नाही तर तुम्हाला लाईफ मध्ये दिशा पण दाखवली. ओके. तर असे हे सर आज आपल्या या कार्यक्रमाला. And who was the officer in charge in 2004 is really what I will say a pride And we are very lucky to have you today as the chief guest for this particular, and that too when your student is taking over as an officer in charge for this particular program. The another guest today is Dr. Abhay Kolte sir. Like when he was appearing for his MDS exams, we were appearing for our final BDS exams, okay? And we used to study together, okay? रात को 12-1 बजे तक हम study करते थे. And that is how we learn, we grow. And sir served GDC. For many of you may not be knowing, he was selected as a MPSC lecturer in 2005, okay? So he worked till 2005 as a permanent lecturer in the Department of Periodontology. But one fine morning, because his destiny was written somewhere else, so he left the job, and today we are very happy. We are really privileged, and we are really, what I will say, the happiness to all his colleagues, all his juniors, that he has taken over as the dean of one of the most another prestigious institutions of Central India. Sir, I'm sure under your leadership, the college will definitely grow with the leaps and bounds, and I'm sure everybody will see the new heights the Ranjit Deshmukh College will reach. I wish you all the best from all the GDC family, from all the alumni of Government Dental College and Hospital, Nagpur. And the one important thing is he has added one more number to the number of deans who are being given by GDC to this particular uh, country in Maharashtra and in India. So I think it is 69th dean. Sir is very well aware about all these things. Okay. So on behalf of GDC, sir, we wish you very good luck and grand success. And as I already mentioned, the institute will see the newer heights under your leadership. And we also thank you for accepting our invitation to be the guest of honor and to and accepting our felicitation on this particular occasion. We have the subject experts also, Dr. Rajeshri. She was only 1 year senior to me, and Dr. Sai. She is also, both of them are also the alumni of this particular GDC Nagpur. So it's the GDC is like a family, and whosoever is coming to GDC, especially the new postgraduates, you must have seen we try to adopt you just like you are the children of this particular family. इथे सिनियर मोस्ट मॅडम इथे बसलेल्या आहेत. आपल्याला त्या आईसारख्या, आपल्याला ताईसारख्या, दीदीसारख्या प्रत्येक वेळी गाईड करत राहतात. आणि अशा ह्या फॅमिलीमध्ये तुम्ही जेव्हा काम करता, आणि अकॅडमिक्स तर काही प्रश्नच नाही, इट इज व्हेरी गुड. जीडीसी कुठेही आमचे स्टुडंट जाऊ सर त्यांना प्राइज मिळतं. प्रत्येक स्टुडंटकडे 2-3 पब्लिकेशन्स राहतात when they come up to the end. Now we started promoting the patents also. My request to all the students is you must start writing the patents, okay? Because the patent will also have a very important impact in your life when you will be appearing, especially those who want to go into the academics, okay? In your life when you will be appearing for the interviews, okay? And we have a very dynamic R&D cell chairperson now who has started reforming the R&D activities, and I'm sure next 3-4 years we will also see the fruits of that particular activities, which will help all of you. I congratulate and wish Dr. Vaibhav the best luck. And as he mentioned, definitely the journal will come up with some new ideas with the help of all of our colleagues, all our faculty. And I thank you once again. Thank you, Jai Hind, Jai Maharashtra. And I wish both the new link editors and the previous editors, Dr. Pooja and Dr. Urvi, who also did the wonderful job. The thing is, like, I'm not criticizing anybody, but to collect the case, which is actually interdepartmental, interdisciplinary, was the biggest challenge for all the three officer in charge and the editors. Okay. So I request the PGs and their guides this year, they should not have much trouble in collecting your data for the presentation, because ultimately it will be a sort of publication which we have already released the journal. I congratulate all of you. Thank you. Jai Hind, Jai Maharashtra.
Thank you so much, sir, for being a constant support. I request Dr. Vivek Thomre, sir, to introduce our guest of honor, Dr. Abhay Kolte, sir.
Very good afternoon to one and all. Respected dignitaries on the days of the days, dear students. It's indeed a great pleasure and an honor for me to introduce respected Dr. Abhay Kolte sir. Although he does not require any introductions for all of us sitting in the auditorium, but as we are felicitating him, it's my moral duty to introduce him. Dr. Abhay Kolte sir has done his BDS in the year 1991 and MDS in 1996 from the esteemed institute that is GDCH Nagpur. Currently, he is working as the Dean, Professor, Postgraduate Teacher, PhD Supervisor, and Head of the Department of Periodontology at Ranjit Deshmukh Dental College, Nagpur. He has also done his postgraduate diploma in Hospital and Healthcare Management from Yashwantrao Chauhan Maharashtra Open University. Dr. Kolte sir has more than 27 years of teaching experience. He has been invited as a keynote speaker at various international and national forums. He has more than 160 publications in various international and national journals to his credit. He has chaired scientific sessions in specialty and other dental conferences across India. He has been actively involved in organizing various conferences. He has the honor of being the treasurer of Second National Conference of Indian Society of Periodontology in the year 1998. He was the organizing secretary of 62nd National Indian Dental Conference held at Nagpur in year 2009. He was the organizing chairman of the Conference of Indian Society of Periodontology held at Nagpur. He was the past president of Indian Dental Association Nagpur branch. He was the past president of Indian Dental Association Maharashtra State branch, and he has worked as a member of Board of Clinical Studies in Maharashtra University of Health Sciences. He has many awards to his credit. To name a few, the Best Teacher Award instituted in the name of Dr. Sharidini Daunkar Best Teacher Award instituted by Maharashtra University of Health Sciences in the year 2012-2013. He has been awarded with the Best President for the local branch, that is Indian Dental Association, and Best President for the Maharashtra State Indian Dental Association branch. He has over 40 copyrights to his credit. He is the reviewer for many national and international journals. He is an astute clinician, and he has also published a book titled Fundamentals in Periodontology and Implantology. Above all, he is a thought-provoking teacher, a kind-hearted person, and I'll say a person who speaks more by his action, and his action speaks louder than his words. We welcome you, sir. Thank you very much.
Thank you, sir. We also acknowledge the presence of Dr. Tushar Srirao, sir, and I request Dr. Padnaik, sir, to felicitate Dr. Tushar Srirao. Vice President of ISP Head Office. I now request our guest of honor, Dr. Abhay Kolte, sir, to please share his views.
Dignitaries on the dais, chief guest of today's function, and my mentor, guide,
and everything in the dental profession as well as outside in my life. Dr. R.K. Yeltiwar sir, Dean, Government Dental College and Hospital, Nagpur, Dr. Abhay Datarkar, dignitaries, other dignitaries on the dais, Dr. Manjusha Varatpande Madam, Dr. Patnaik sir, Dr. Sulekha Gosavi, Dr. Vaibhav Karimori, dignitaries of the dais, heads of the department, my colleagues and dear friends. It's really an emotional moment for me coming over here after so many years. In fact, we have been coming to this institute for many number of times, but then coming on this podium really reminds you and get jitters in you because the first paper which I presented during my student life was on this podium. And the memories are quite strong. I still remember I walked into this college from the backside gate and should not say this, but then the first day we were ranked, and that was those days it was a matter of routine, but then that was only for a few days. Thereafter, we developed thick relations with our seniors, with our colleagues, with our juniors, and I also remember I learned everything. In fact, I must confess that I am indebted to this institute, to my teachers, Dr. Yeldivar sir. I can see some of them, Dr. Varatpande madam, Dr. Pannaik sir, Dr. Ratke madam, Dr. Nayyar madam, Dr. Manikar madam, Dr. Pandilwar sir. I would never forget you. You have been one of the teachers who held our hands and taught us extractions. That was really, really helpful and is really helpful even today. Kharikar sir was not there in Nagpur those times. He was in Aurangabad. Then Ritesh was our colleague. He had joined the institute, was not an alumni of this institute, but then he joined this institute and later on we developed quite good relations. The junior staff members, I still feel that I was the same as you are today. And we really enjoyed the life which we spent, the days which we spent in government dental college. And I would say that nothing is constant in this world except change. And this is what I'm experiencing today. I was one of you a few years back, and today I'm sitting on the opposite side. But then coming on this side gives you a lot more responsibilities and a lot more burden on your heads because you not only have to perform yourself, but then you have to take all the people with you. And this is what has been taught to us by the Government Dental College and Hospital Nagpur. I can proudly say that I am an alumni of Government Dental College and Hospital Nagpur, and many people would remember the fact that whoever has spent 4 years in this institute would always succeed. And not only the 4 years of undergraduation, but also the 3 years of post graduation. Whichever opportunity you get to get into this institute, be it as a UG student or a postgraduate student, you are going to learn many things and you are going to succeed in your life. My best wishes to the young generation which is sitting over here and would not take much of your time. I would like to thank the organizers for inviting me over here and also all of you for giving me your patience here. Thank you.
Thank you so much, sir, for your wise words. I now request Dr. Vaibhav Karimori, sir, to introduce our chief guest, Dr. Yeltivar, sir.
Respected August gathering. Uh, First of all, I apologize for breaking the protocol because when the question comes that who will introduce Dr. Yeltivar, sir, I was a bit arrogant. None other than myself will introduce Dr. Yeltivar, sir. I'm very sorry. क्योंकि जब मेरे सर के बारे में बात करने की बात होगी तो मैं बात करूंगा. ओके. So everyone knows what Dr. Yeltivar sir is. UG student and PG student of this institute. Then worked as a lecturer, associate professor, and HOD. Not only at Nagpur but GDC Aurangabad also. Then he took his voluntary retirement and joined Roongta Dental College at Chhattisgarh. Then he came back to Vidarbha again. VYWS Dental College, he was PG director there. He retired from VYWS Dental College, Amravati. And the beauty of his retirement day was, it was a grand function what we all have witnessed. All his students were gathered there on the day of his retirement. This speaks about his popularity, this speaks about his gentleness, and this speaks about what the guru he is. So big claps for my sir, Dr. Yeshiva sir. Apart from publications and apart from the deliberation, whatever goes, past president IDA Nagpur branch, and he has bestowed the key post at ISP head office. He has received the award named Guru of the Gurus. So this is a great thing. Okay, everyone gets the best teacher award, best student award, but the Guru of the Gurus award, he's a recipient of that, and we all are fortunate to have a guru like this. He's the bestest human being what we have seen in our life. Bestest. This is new term in the dictionary, you can say. What to talk about our sir? यल्टीवार सर के स्टूडेंट यहाँ कुलते मैम बैठे हैं, कुलते सर बैठे हैं, मैं हूँ खुद. हम सब उनके स्टूडेंट है. कोई यूजी है, कोई पीजी है. वो गाइड थे हमारे, राइट? एंड व्हेन योर गाइड इज राम, जय श्री राम. When your guide is Ram, so everything is like red carpet for you in your life. So this is the person named Ram Reddy K Yeltivar is our proud guide. और हम तो प्राउडली बोलते हैं सर, राम रसायन हमारे पास आ. तो ऐसा रसायन जो एक बहुत ही अच्छे ह्यूमन बीइंग है, बहुत अच्छे गाइड तो ऑफकोर्स है, नॉट फॉर हिज स्टूडेंट, फॉर देयर स्पाउसेस, फॉर हिज ग्रैंडसन्स एंड हिज ग्रैंड डॉटर्स. वो अभी भी अपनी फैमिली की तरह सबको आज तक लेके चले हुए. एंड वी कॉल ourselves as a Yeltivar family. So ladies and gentlemen, may I request Dr. Yeltivar sir to please come on the dais and आशीर्वचन पर कुछ शब्द हमारे साथ. Thank you.
मैं मराठीत बोलणार. इंग्रजी भाषा आपली नाही आहे आणि आत्मीयता नसते त्याच्यात. या दंत कॉलेज, दंत महाविद्यालयाला माता रूपी मानतो मी. या मातेने त्या बाळांना जन्म दिलेला आहे. माझे आज अकॅडमिक पुत्र डीन झालेले आहेत. डेंटल कॉलेज नागपूरचा जिकडे तिकडे जलवा आहे. जलवा इन द सेन्स, जॉईंट डायरेक्टर पासून माझे विद्यार्थी आहेत. विवेक पाकमोडे, माया इंदुरकर औरंगाबादला, भाड मॅडम मुंबईला, अभय दातारकर नागपूरला. VSPM चं नाव बदलून त्यांनी आता रणजित देशमुख डेंटल कॉलेज केलेलं आहे. आणि मी अभयला आज सकाळीचा प्रश्न विचारला, व्हॉट इज द मिनिंग ऑफ RD? RD मधूनच उदय झालेला आहे. RD म्हणजे काय? रबर डॅम. रबर डॅम हा सरांचा संशोधनाचा विषय होता. ज्यावेळी भारतीय रुग्णांना स्वस्त उपचार पद्धती विकसित कसं करायचं ह्याकरता सर्वप्रथम आपल्याच महाविद्यालयातून माझा विद्यार्थी अभय त्यांनी कंपॅरेटिव्ह ते गोरेलोस म्हणजे गोरटेक्स मेम्ब्रेन, गोरटेक्स मेम्ब्रेन विरुद्ध आपलं भारतीय रबर डॅम यांचं कंपॅरेटिव्ह स्टेटमेंट करून एक सायंटिफिक पहिला प्रयोग केलेला आहे. समजलं? आणि तेव्हापासूनच कोणी अभयचे सगळे गुण ओळखले नाही. एक संत एकदम सायलेंट माणूस, परंतु आतमधून खूप हुशार आहे. आणि ही न्यूज रणनीती कशी करायची आयडीए मध्ये पण बरोबर त्याने आपलं स्थान पक्क मजबूत केलं. त्यानंतर देशाच्या सर्वोच्च पदावर अध्यक्ष म्हणून भूषवलेलं आहे. आणि जेव्हा आपले मुलं अशी मोठं होतात तर बापाची काय अवस्था होते तुम्हाला समजेल. माझी सून पण इथेच बसलेली आहे. आणि दोघेही विद्यार्थी एकाच मार्गदर्शनाखाली झालेले विद्यार्थी हे बहुतेक फार कमी क्वचित आढळतात. तर देवाची परमकृपा आहे माझ्यावर, त्याच्यामुळे सगळं मला अनुभवाला मिळत आलंय. तर मी जास्त बोलणार नाही कारण आधीच आपला वेळ गेलेला आहे. Otherwise, I would have talked much more, but we are running short of time, and therefore, to all my colleagues that time, Dr. Khadikar, Aurangabad colleague, Madam, आधीपासूनच आहे स्टुडंट लाईफ, त्यानंतर पण औरंगाबादला होत्या तिथं मानेकर मॅडम, आणि सिनियर मध्ये हा मॅडम आहेत गडके मॅडम, हा सगळे मॅडम. काश्मीर वगैरे उनको आपने दिखाया. रैना मॅडम. तर सगळ्यांना वंदन करून मी माझे 2 शब्द.
Thank you, sir. Looking forward to learn a lot from you. We shall now proceed with the presentation of today's link activity by the Department of Periodontology and Prosthodontics. I request our dignitaries to kindly occupy the seats in the audience to witness today's presentation. First presentation is by the Department of Periodontology. I would like to call upon all the presenters to start with the presentation.
ठीक है. Nice. Nice. कौन है? बाहर हरी है. ओ हरी वक्त हरी ना. अभी सर्व कर देते ना, टाइम हो गया है. हाँ ठीक कर भाई.
Good afternoon, everyone. Dentistry is the art of transforming people's mind. We, the Department of Periodontology, are going to present few cases in which we have achieved beautiful smile via perioaesthetic procedures. If beauty is the power, smile is its word. A harmony between the lip,
the teeth, and the musculature is important in achieving an aesthetic smile. Periodontal prosthetic and aesthetic procedures include perioplastic surgery, which is defined as the surgical procedures performed to correct gingival, anatomical, or traumatic tissues of the gingiva or the alveolar mucosa. The periodontal aesthetic procedures include different procedures such as gingivectomy, depigmentation, procedures to correct the anatomical deformities or the pathological deformities, the papilla reconstruction procedures, root coverage procedures, etc. Presenting our first case. Good afternoon, all. Starting with the first case of today's perioesthetic case presentation, that is gingivectomy. So gingivectomy is basically a surgical procedure done to remove the deceased or the enlarged gums. This was a 21-year-old systemically healthy patient come to the Department of Periodontology with the chief complaint of unesthetic appearance due to excessive display of the gingiva. Also, she had gummy smile and forwardly placed upper and lower anterior tooth region. So we referred the patient to the Department of Orthodontics for further opinion. I will request Dr. Ahmed sir to kindly explain her orthodontic treatment planning.
So this was a 21-year-old female patient reported to the Department of Orthodontics with the chief complaint of having the forwardly placed upper and lower front teeth. On medical examination, it was shown that there was increase of the overjet, severe inclination of the upper and lower anterior. Along with there was Lawson molar and canine deficiency. Lips were also incompetent. So we wait for the radiographic examination, taken the OPG, taken the lateral cephalogram, and did the analysis. That analysis shows that there was severe inclination of the upper anterior. So based on the clinical and radiographic findings, we arrived at the treatment plan of first was the gingivectomy of upper and lower anterior since there was excessive growth of the gingiva, upper and lower anterior region, so that we can gain the enough amount of clinical crown height and that can be facilitate the bonding of the fixed appliance orthodontic treatment. And based on the space discrepancy in the malabsorption requirement of the species for that, it was decided to go for the extraction of all first molars followed by the fixed orthodontic therapy.
On taking thorough case history, we have found that there was high labial maxillary phenum, which is of gingival type. Gingival hyperplasia was there in both anterior maxillary and mandibular anterior tooth region. Transgingival probing was done, and on the basis of clinical and radiographic findings, we have come to the diagnosis that there was an altered passive eruption with idiopathic gingival enlargement. And according to Kirsten's, it has classification for altered passive eruption. This was type 1A. And so the treatment planning for the case was phase 1 periodontal therapy followed by splenectomy and external bevel gingivectomy. Coming to the surgical procedure, under all aseptic conditions and precautions, adequate local anesthesia was achieved, and number 15 blade was used to incise the high cranial attachment. All the gingival fibers were released and suturing was done. Periodontal pocket depths were measured and all the bleeding points were marked, and external bevel incision were placed at 45-degree angle slightly apical to the bleeding points, and the tissue were excised. Physiological architecture were maintained by gingivoplasty. Similar procedure has been repeated for the mandibular anterior tooth region. Uneventful healing can be observed after 7 days of follow-up period. Appreciable results can be obtained in pre and post-operative orthodontic treatment. Then we referred the patient to the Department of Orthodontics for further treatment.
At this stage, the patient was ready to go for the fixed orthodontic treatment. His extraction was done and the gingivectomy was also done. So we started the bonding of the fixed appliance and we started with the alignment and labeling, and still the patient's orthodontic treatment is still carrying on.
To support my surgery, Gracia et al. And Ayu et al. had done the similar studies in which they have find the aesthetically very good results. This is how application sounds like.
मैं गवर्नमेंट इंटर कॉलेज नागपुर आई थी बेसिस लगवाने के लिए और वहाँ पे ऑर्थोडोंटिक डिपार्टमेंट में गई। उन्होंने मुझे बताया कि मेरे कर्ज बहुत सूजे हुए हैं इसलिए मुझे बेसिस नहीं लग सकते। उन्होंने मुझे पेरियोडिक डिपार्टमेंट भेजा और पेरियोडिक डिपार्टमेंट वालों ने बहुत अच्छे से गाइड किया और बताया कि आगे की प्रोसेस कैसे करना है। उसके बाद मैंने सर्जरी और सर्जरी के बाद मेरे कर्ज को कॉम्बिनेशन बहुत अच्छा लगने लगा और मैं कॉन्फिडेंट स्माइल कर पाई थी। मुझमें एक विश्वास आ गया था कि भविष्य में मेरी स्माइल बहुत अच्छी हो सकती है और करेक्ट हो सकती है और इसलिए मैं गवर्नमेंट मेडिकल कॉलेज ऑफ नागपुर का तहे दिल से धन्यवाद करती हूँ।
Heading towards the next case, that is gingival depigmentation. Gingival depigmentation is a periodontal plastic surgery done in order to remove the melanocytic hyperpigmentation. Melanin is basically an endogenous pigment present in the stratum basale layer of the epidermis, which needs to be removed. So, this was a 22-year-old systemically healthy patient come to the Department of Periodontology with a chief complaint of dark gums and malaligned tooth. On examination, we found that there were mixed brownish and pinkish pigmentation over both maxillary and mandibular anterior tooth region. So, according to Dummets oral pigmentation index, the score was assigned as 2 in both maxillary and mandibular tooth region. In literature, there are various techniques for gingival depigmentation, like surgical scraping, laser, electrocautery, cryosurgery, vitamin C injection. Out of this, in this case, we have used scalpel and burr technique. Under all aseptic conditions, adequate local anesthesia was achieved. The area to be depithelialized was marked, and using scalpel and blade number 15, we have depithelialized the area. Similarly, in the mandibular anterior tooth region, we have used the burr and depithelized the area. Periodontal pack was given to the patient and patient is under follow-up visits. We can appreciate the follow-up results 1 month and 6 months. Afterwards, the patient has been sent to the Department of Orthodontics for her further treatment planning.
This patient again referred to the Department of Orthodontics, having the chief complaint of spacing in the upper front teeth. Since the patient was concerned with her aesthetic that was compromised due to the spacing in anterior region, clinical examination we did, we found there was class 1 molar canine relationships and increased overjet due to the severe inclination which also causing the spacing in the anterior region. Midline lesion was also found in the anterior region. Since the on clinical examination, we found that the occlusion of the patient was more towards normal apart from the spacing in the upper anterior region. On clinical examination, we arrived at the treatment planning that we suggest the removable appliance therapy for this case, avoiding the long and lengthy procedure of the fixed orthodontic treatment. So the removable appliance incorporated the Adams clasp and short labial bow that was provided to the patient, and the treatment is still going on for this patient.
This is the 1 year of follow period with no sign of recurrence and excellent aesthetic outcomes. And this look at her beautiful smile transformation. Bende et al. And Izzat et al. Has done the similar studies and found that there were aesthetically good results with scalpel and blade method along with burr technique with low rate of recurrence. Coming forward to the next case, there was a 48-year-old female who reported to the Department of Periodontology with an underconfident smile because she had an overgrowth in the maxillary anterior aesthetic zone, which was persistent with 16 years recurrence. She had 3 recurrences in the past, which she got excised with the conventional method in the private dental practices, and she later reported to the Department of Periodontology with a similar complaint, and she had kept few records of her previous treatment. On clinical examination, we noticed a overgrowth in the maxillary anterior region extending from 1-1 to 2-2. On clinical examination, the lesion was bleeding profusely while measuring the pocket depth, and it also bled while brushing. There was a fixed partial denture extending from 1-1 to 2-3 region, and the patient was quite happy with the prosthesis, but prosthesis had no mobility, still it showed some signs of wear and tear. Patient was counseled regarding the removal of prosthesis before getting the excision done, but patient did not consent for the same. So we went for the conventional method for excision of this lesion with the scalpel. We thoroughly examined the patient and later referred the patient to Department of Oral Diagnosis and Radiology. And we also had some blood investigations such as CBC, BTCT, RBS, etc. done for the knowing the cause of the lesion and why it had such an aggressive recurrence.
When the patient was referred to the Department of Oral Radiology for the interpretation of the OPG, we saw that multiple missing teeth were seen in all the four quadrants, but we can also see radio-opaque processes in the maxillary and the mandibular anterior extending from 1-2 to 2-2 and in the lower mandibular anteriors from 3-2 to 4-2. Radiopaque filling can also be noticed in 1-2, which might be suggestive of an endodontic treatment. An impacted 2-3 can also be seen. Percussion involvement was seen with 3-6 and a generalized moderate horizontal bone loss was seen in the OPG.
After the radiological investigation, he had confirmed that there was no bony interference in this area, suggestive of a soft tissue lesion. So we went along with the conventional surgical excision method with the scalpel and sent the specimen for biopsy to the oral pathology department.
On histopathological examination, the HND stain section shows the parachitinous outwards from the epithelium showing the short and blunt tear edges, and the underlying lesional connective tissue stroma shows dense collagen fiber bundles that appears to be hyalinized at few places, and few vascular endothelial line spaces, and few blood vessels that are engorged with RPCs, and the mild to moderate chronic inflammatory cell infiltrate in the form of lymphocytes and plasma cells, and the deeper part of the section shows muscle tissue. So most of the features are suggestive of pyogenic granuloma. We came to the diagnosis of pyogenic granuloma.
While the histologic report was still in progress to be developed, our patient reported at the third day to the Department of Periodontology with a recurrence. After receiving the histopathological diagnosis, we were very sure why this aggressive lesion recurred. Within 3 days, we saw blanching, so we decided to go along with a different treatment modality for the excision of this lesion. We excised the lesion with the help of scalpel, but we also this time removed the prosthesis and the patient consent was obtained after thorough counseling. We also did an osteoplasty for the lesion so that any underlying bony specules might have been the cause of recurrence in the past. Since the patient did not remove the prosthesis in the past recurring lesion and excisions were done without removing the prosthesis, the underlying cause of pyogenic granuloma is generally a traumatic one. To be very sure that the lesion does not recur, we applied carnoid solution to the borders of the lesion and used photobiomodulation disinfection of diode laser. And for a soft tissue healing, since the lesion was aggressive in nature, we used PRF membrane for a better healing. We counseled the patient not to wear any denture or removable or fixed prosthesis for a period of at least 1 month because we wanted to be very sure that the lesion does not recur. The patient was kept under thorough follow-up for 3 months, and after we were sure that there was no inflammation, no other infection, and no recurrence, we referred patient back to the Department of Prosthodontics for the prosthetic rehabilitation.
The patient was referred to the Department of Prosthodontics, and there was an edentulous case with respect to 1112, 1121, and 22. We went ahead with the metal bridge in the second quadrant. because the patient had financial limitation, and we planned a cast partial lecture. We did not plan a fixed procedure with this patient because we wanted to check if there are any recurrences in the soft tissue lesion. And we went for a complete palpable major connector and referred the patient back to the Department of Periodontology for further evaluation.
Patient is followed till date. This is the 3 months, 6 months, and the recent 2 year follow-up of the patient. We every time check the patient for the wear and tear of the prosthesis, that is the cast partial denture, and all the tooth where they have infected or not, since there is a canine present in the region which was deeply impacted, and the oral surgery department uh, consulted us regarding the impaction of the canine. But since it was deeply placed and the patient did not want to undergo any extravagant surgery for the removal of the canine, patient is still under follow-up, and this is the 2 year follow-up of the patient. Patient is very happy with the prosthetic rehabilitation. This is the pre-operative before the second lesion and 2 year follow-up photograph. This is the testimonial of the patient recently who visited the department.
मुझे 15 साल पहले एग्जाम में बहुत बड़ी हुआ था, तो मुझे 15 साल पहले मैंने उसको निकाला था। उसके बाद फिर से आई तो मुझे 10 साल के बाद भी निकाला और फिर से फिर 5 साल के बाद निकाला, लेकिन वो ग्रोथ आना बंद नहीं हुआ। फिर मैं यहाँ आई, तो यहाँ पे मुझे पहले फिक्स दांत लगे थे, लेकिन मैंने बोला फिक्स दांत नहीं निकाला है, लेकिन यहाँ पे मैम ने समझाया कि नहीं, फिक्स दांत जो लगे हुए हैं उसको निकालना पड़ेगा, तभी इसका सोल्यूशन निकलेगा। तो फिर फिक्स दांत निकालने के बाद यहाँ पे 2 बार ग्रोथ का सीजरिंग हुआ। उसके बाद दांत लगे, अब मुझे यहाँ पे ग्रोथ आ रही है, मुझे 10 साल लगे, लेकिन मुझे कोई प्रॉब्लम नहीं है, तब से मैं अच्छी हूँ।
Going forward to our next case.
So moving forward to the next case of the case series, the crown lengthening procedure. So here, the 18-year-old female patient came with a chief complaint of poor appearance of her upper front teeth. So when we took the detailed case history, we came to know that she has a history of trauma 1 year back, and there was a root canal treatment done with respect to 1-1 and 2-1. So on further oral examination, measuring the pocket probing depth and the clinical crown height, we came to know that the teeth heights were shorter than the normal, and also there was a discolored 1-1 and 2-1. Further, we went for the radiographical examination. So Dr. Srishti will highlight it further.
The patient was referred to the Department of Oral Radiology and was advised OPG. On this OPG, we can see that 1-8 and 2-8 cannot be seen, and a radiopaque filling can be seen with respect to 1-1 and 1-2, which is suggestive of an endodontic treatment. Here, on commenting on the perio aspect, we can see that well corticated interdental alveolar bone crest level can be seen, which is suggestive that there is no angular or horizontal bone loss. And by giving this, after giving this interpretation, we referred the patient back to the Department of Periodontology. So further, after the oral examination and the radiological examination, you could see that it came into the ultratarsal eruption classification 1B. So we went for the further treatment planning of aesthetic crown lengthening along with the crown placement of 1-1 and 2-1. So moving forward to the surgical procedure, at first the internal bevel and the clavicular incision was given from 1-3 to 2-3, and the full thickness mucoperiosteal flap was reflected. After reflection, we could appreciate the bone level, and also the excess gingival collar tissue was removed. So for achieving the biologic width, the bone reduction was done, and the flap valley approximated using the interrupted sutures. This is the 1-1 follow-up picture or photograph. So further, the patient was referred to the prostho department for her replacement of the crown. When this patient reported to us on intraoral examination, we could see that there was tooth discoloration with respect to 1-1 and 2-1. We provided her with various material options for the fabrication of crown prosthesis, and zirconia crowns were selected. Tooth preparation was done with respect to 1-1 and 2-1. Gingival retraction was achieved with the help of triple zero retraction cord. Final impression was made using polyvinyl siloxane impression material, and zirconia crowns were fabricated, which were then cemented using glass ionomer cement, and the patient was referred to the Department of Periodontology. Further, this is the 1 year follow-up photograph of the patient.
We could see the smile transformation of this patient and how confidently she's smiling now. Supporting to this case, Pablo et al. And the VS et al. Had done the similar studies where they have obtained a very good aesthetic results with the crown lengthening procedure. Let's see something from the patient's own words.
मेरा नाम रिया है, मैं कबड्डी नेशनल प्लेयर हूँ। तो मेरे खेलते खेलते मेरे आधे दांत टूट गए थे, तो मैंने सोचा कि मतलब मैंने प्राइवेट हॉस्पिटल में जाके मैंने अपना इलाज करवाया। उसके बाद उन्होंने मेरा रूट कैनल किया। तो उसके बाद कुछ साल तक मुझे ज़रूरत नहीं लगी कि मैं अपना कैप बिठाऊँ। तो उसकी कुछ फ्रेंड्स मेरे बोलते थे कि मेरे आधे दांत थे, तो मेरे पे हंसते थे। तो मैंने सोचा मैं कैप बिठाऊँ। तो मैं गवर्नमेंट हॉस्पिटल में आई। गवर्नमेंट हॉस्पिटल में आने के बाद मैं कैप बिठाने वाले डिपार्टमेंट में गई। उन्होंने मुझे बताया कि आपकी दांतों की मतलब आपकी जो गम की लेंथ है वो कुछ ज़्यादा है। तो मैं उसके बाद अपने गम की लेंथ बढ़ाने के लिए सेकंड मतलब 202 में फ्लोर पे आई। तो उन्होंने मुझे बताया कि मतलब उन्होंने मेरा ट्रीटमेंट किया। मतलब मसूड़ों का लेंथ उन्होंने मेरी बढ़ा के दी। मेरी स्माइल पे मैंने भी उनको बताया कि मेरी स्माइल अच्छी नहीं आती है। तो उन्होंने मेरा लेंथ कम करके मेरे स्माइल के लिए उन्होंने बहुत अच्छी ट्रीटमेंट करवा के दी। अगर किसी को रिक्वायरमेंट रहता है तो आप लोग भी गवर्नमेंट कॉलेज में आके अपना ट्रीटमेंट करवा सकते हो। बहुत ही अच्छे से ट्रीटमेंट करवा के देते हैं। और मैं अभी अच्छी भी फील करती हूँ, मेरी स्माइल भी बहुत अच्छी आती है। और मुझे भी कोई भी प्रॉब्लम नहीं होता है स्माइल करते समय या तो फिर कुछ खाना खाते समय कोई भी प्रॉब्लम नहीं है। मेरा नाम रिया है।
Moving forward to the next case. So here, a 40-year-old female patient, she came with a complaint that she wanted a prosthesis with the left second premolar. At first, the patient was referred to the perio just because her crown was very less in height. So, and on taking the history, we came to know that her root canal treatment was done 6 months back. So at first, we preferred for conventional crown lengthening procedure treatment along with the gingivectomy and bone reduction. So since the crown height was very less, so that much within the limitation was not achievable. So further, we went for the treatment planning of surgical extrusion for this case. So at first, a previcular incision was given around the tooth, and the tooth then further syndesmotomy was done using a periodontal, where the periodontal fibers around the tooth was released, and using the elevator, the tooth were luxated. Further, after the extrusion, for the stabilization of the teeth, the fiber splinting was done for 2 weeks. We can see that the 3 weeks post-op clinical view of this case, and there was an uneventful healing. Further, Dr. Saluri will highlight about the prosthodont. When the patient reported to us, we could see that there was sufficient collar height to give us the period effect. So we went ahead and decided that post and go should be done. So the on IOP examination, we based on the IOP examination, canal space was prepared with the piece of beam of 2 and 3, and the appropriate size fiber post was selected, which was then cemented onto the tooth. The core buildup was done, and tooth preparation was done with respect to that tooth. Gingival retraction was achieved, and final impression was made. And zirconia crown and PFM crown was then cemented using glass ionomer cement. Further, this is the 3 months follow-up photograph of the patient, where we could see that the prosthodontic rehab was done, and the further complication was not seen. Supporting to this case, Chang et al. And Rami et al. They had done the similar studies where they have concluded like there was no marginal bone loss, or also there was no change in the attached gingiva. So this was a successful technique. So moving on to the next case. The next case is of a 22-year-old female patient who came to the Department of Perio with OPD, the complaint of an unpleasant smile. The patient's orthodontic treatment was initiated at the Department of Orthodontics in a college, but later, due to pandemic reasons, the patient continued her treatment in the private clinic. On clinical examination, we could see that on patient's full smile, the teeth from maxillary left first premolar to maxillary right first premolar were visible, and there was an excessive gingival display of 5 to 6 mm. So we came to the diagnosis of excessive gingival display, or commonly called as gummy smile. Gummy smile is a multifactorial condition which needs to be managed in a sequential manner. Considering one of the treatment options, which is a lesser invasive option called as the surgical lip repositioning, in which we limit the retraction of the retractor muscles of the lip. As the patient had no other contributory medical history and there were no complications for the surgery, The patient was planned for surgical lip repositioning. Under all the aseptic conditions and after administration of anesthesia, an area of 10 to 12 mm of the mucosa which was to be removed was marked using a marking pencil. The first and the width of the incision was extended up to the last tooth, which was visible on a complete horizontal smile. A first partial thickness incision was made 1 mm apical to the mucogingival junction, and a second incision parallel to it was given 10 to 12 mm above the first incision. And these two incisions were then connected at the central incisor region. The epithelium within this outline was then carefully removed and leaving the underlying connective tissue exposed. This was the excised tissue which was removed. The two incisions were then connected using continuous interlocking sutures, and the patient was prescribed antibiotics and analgesics, and a special instruction was given to patient to restrict the lip movements for at least 1 to 2 weeks and application of ice pack to prevent any further swelling. This was a photograph after 6 months where we can see that the gingival display was reduced by almost 3 mm and the patient was satisfied with the aesthetics. Later again, the patient came back after completion of an orthodontic treatment and we decided to go with aesthetic crown leveling as there was a disparity in her crown height and gingival zenith in the right and left anterior teeth. So after aesthetic crown leveling was done and depigmentation was done using scalpel. This was the immediate post-op photo and the follow-up photographs after 15 days and 1 month. This is the latest photo where we can see that the patient's smile had improved, better aesthetics, and patient is highly satisfied of her appearance now.
Since we are talking about aesthetics in the periodontal, and yet we have not seen any case of the root coverage. So now the next case is on the root coverage procedure. The root coverage is a part of the periodontal plastic surgery, the term given by the Miller in 1993. Along with all of these procedure, root coverage is also a part of plastic surgery. Let's take some glimpse of the history for the root coverage procedure. In last 3 decades, there are many approaches has been developed, has been practiced for the root coverage procedure. In 1970 to 1980, there are two kind of the approaches which practiced. One is pedicle flap and one is gingival graft. Coming to 1980 to 1990, new approaches like bilateral technique were practiced. And in last decade, aesthetic demand increased. So there are various approaches has been developed. Out of all that approaches, we can in broad term categorize it into the three category. First is the FGG, second is the coronary advanced flap, and third is the combined approach in which the coronary advanced flap along with some interspersed material can be used. In this technique, our case, we use the combined approach in which we use coronary advanced flap along with the connective tissue graft. So 24-year-old patient came to the department with the chief complaint of repeated tartar formation and low level of her gum in lower anterior teeth. On examination, the localized class recession with 3141 and 42 was diagnosed. So we decided the treatment plan, starting with the phase 1 periodontal therapy. We kept the patient under the follow-up to check her compliance with the oral hygiene. After good compliance with the oral hygiene observed, we planned the surgery, which was the connective tissue graft with, along with the coronary advanced flap. So starting with the surgical procedure, after giving the two incisions, first one is a horizontal at the base of the papilla, and another second incision was the vertical incision at both the end of the horizontal incision, and make the trapezoid shape of the flap. After that, flap was reflected in full split manner, followed by apical suprapedestal releasing incision was given, and adequate coronary advancement was achieved. After that, using a tin foil, we measure the size for the CTG and transfer that painful to the donor area, which was left maxillary palate, molar premolar area. And after that, the trapdoor incision was given and CTG was harvested. After that, CTG was transferred to the recipient site and stabilized with the stabilizing suture, followed by the flap was coronally advanced such that it remains above the CEJ and stabilized with the interproximal and apicocoronal interrupted suture, followed by the periodontal dressing was given and donor side was protected by application of the cyanoacrylate by a tissue bioadhesive. This is the healing after 7 days at the recipient side, and adjacent there is a healing of the donor side after 7 days. We can see at the 3 month healing at the recipient side and at the donor side. Here we can compare the pre-op and the after third month follow-up photograph. We can appreciate that almost complete root coverage was achieved, and really nice chromatic and texture integrity with the resident tissue was achieved. In this photograph, we can appreciate that almost 2 of the root coverage was achieved successfully. Coming to the supporting literature, as we successfully achieved the root coverage, which was supported by the Cortellini et al. In 2012 in his article in period 2000, they mentioned that among the different combinations, coronary advanced plate plus CTG demonstrate a best outcome. It wins all the game for all the most common surrogate outcomes in all other techniques. It provides the best short-term and long-term outcomes in terms of the root coverage and gain the keratinized tissue with the highest prevalence of the success. So it is easy to suggest that the clinician should adopt coronally advanced flap plus CTG for the root coverage. Now, next.
So we come to the last stage of today's presentation. As we all know that implant therapy has evolved as a successful treatment option for treating the partial and complete edentulation. So we present to you a case wherein the patient reported with a fractured teeth and how we have rehabilitated it with the implant supported prosthesis. Here, a 25-year-old male patient reported with the chief complaints of mobile upper front pain. On clinical examination, we saw that there was grade 2 mobility with 2-1 and a prosthesis with 1-1. Patient gave history of root canal treatment with 1-1. Patient was then referred for radiographic examination. This CBCT scan shows multiple sections which we will be seeing one by one. So in the coronal section, we can see that the radiolucent line can be seen with respect to 2-1 from the medial distal aspect, which is suggestive of root fracture with respect to 2-1. Now coming to the sagittal section, we can again see radiolucent line passing from the upper to the distal aspect, and also notice a radiolucency in the center, which is suggestive of results. And loss of lamina dura with the same teeth can be noticed. So, as after radiographic examination, we got to know that there is internal resorption along with root fracture. We decided to go ahead with immediate implant placement followed by prosthesis. So, under all aseptic precautions, local anesthesia was administered and 2-1 was automatically extracted. As the implant site was in close proximity to the nasopalatine canal, the contents of the canal was curettage and implant osteotomy done. Followed by that, implant was of size 4 by 10 mm was placed and guided bone regeneration performed with DFTBA plus collagen membrane. Healing abutment was then attached to the fixture. The flaps were then approximated. We can see the image. After 3 months of waiting period, we recalled the patient, impression was taken and prosthesis delivered to the patient. We can see the clinical picture and the radiograph provide a successful treatment option. So, to summarize our today's aesthetic dentistry approach in which periodontal treatment should play a vital role. We should focus on treating the patient in such a way that a harmonious relationship is maintained between the teeth and is supporting hard and soft tissue structures. I would like to conclude our presentation with a quote. Because smile is and always be the most prettiest thing you can wear. And looking after the results of all our cases, we can definitely tell the patient मुस्कुराइए क्योंकि आप जीडीसी नागपुर में हैं. Thank you. I request our dean sir, subject experts, and the audience to kindly put forth the questions to the presenters.
So very nice presentation by all the coaches. Very good selection and very well executed using the interdisciplinary approach. Also I would like to congratulate the new body of the NXT led by Dr. Vaibhav Arekure and his team. So congratulations, Vaibhav. And as we know, nowadays in our aesthetic oriented society, people always demand for more and more treatments. They are ready to get the treatment done at any to improve their appearance and the aesthetics. Okay, and for this aesthetic treatments, we need the interdisciplinary approach also. So I think this platform of Link Next will be very helpful for all the PG students because to provide the interdisciplinary approach to the patients, one should be updated about the various current treatment modalities, what is going on in the other specialties also. So I think this is the best platform that you have got in your college to know about the other specialties also. So that's all. Any questions from the audience?
Thank you, presenters, for the wonderful presentation. Moving ahead to the second presentation by the Department of Orthodontics, I would like to call upon all the presenters to start with their presentation.
Oh,